Do something. Do more than you did yesterday.
This is the Loyola Health Equity Quest, and it's become a pillar signature event for the Parkinson School.
There's a real risk if we don't do anything in healthcare that the healthcare's carbon footprint just organically triples.
What we wanted to bring together were a series of focused conversations on a nested set of topics that relate to how do we make healthcare delivery responsive to rapid environmental climate change with a lens of health equity.
It's a time for action. And what's exciting is I think we've convened people that are ready to take that action.
A key to solving some of these inequities is to share power.
When you take people who've been in business for 30 years and you take people who've been teaching for 30 years and you take people who've been in public policy for 30 years and then you add students who have been studying these issues for, somewhere between weeks and a few years, and it just adds a different kind of energy and a different kind of dynamic that's always really great to see.
When I think about this health equity quest, it is very much inextricably linked to achieving environmental justice, and we can't do one without the other.
We were delighted that we had Dr. Jalon White-Newsome from the Biden-Harris administration.
I mean, it's not rocket science, right? None of this is rocket science. We know what we need to do.
I think there are just tremendously smart people sharing not only their work and experiences, but I often love the storytelling piece of what happens, and everybody has a why.
That's what pulled me in as a young Black girl from the west side of Chicago. I'm like, who is this guy talking about the Ogden Corridor when my grandmama was? Wow, he made it real. I was able to relate.
My favorite part is in between, when you get to talk with people who come up and say, wow, I really enjoyed this. So that energizes me to keep going and to keep on our quest.